Urinary tract infection is an inflammatory response of the bladder or the urinary tract to the presence of bacteria. Urinary tract infections can be miserable for most people. You can have urgency, frequency, burning with urination. You can visibly see blood in your urine. Some people have horrible back pain, fever, chills. Interestingly enough, some people can have a urinary tract infection and not have any symptoms whatsoever. When women are first becoming sexually active, they can start to get urinary tract infections. And then the second time that we start to see UTIs is after menopause, when the vaginal tissue becomes dry and the pH changes. We start to see more urinary tract infections. At least 50% of women will experience a urinary tract infection in their lifetime. We screen for urinary tract infections oftentimes based on symptoms. If you come in with symptoms of a UTI, we will check your urine first of all. And the urine oftentimes will be cloudy, will have a foul smell. When we check it in clinic with what we call a dipstick test, it will have white blood cells, bacteria, sometimes red blood cells. That will often prompt us to send the urine out to a lab, which will then do a culture. Cultures can take up to 3 days to actually grow bacteria, and that's where we get the final result. The type of bacteria that you're growing in your urine, and then we test the bacteria against different types of antibiotics so we can determine which type of antibiotic to treat your infection. We don't always know what causes a urinary tract infection. We always want to rule out major things like a kidney stone or an anatomic abnormality such as reflux, where the urine goes backwards up towards the kidneys. So sometimes we get imaging studies. We get an x-ray of the kidneys, we get an ultrasound or a CT scan, or we get an imaging study of the bladder. Sometimes we take a little scope to look inside the bladder just to make sure that we're not missing major things. When we rule all of those things out, then sometimes it comes down to just you and either your behavior or your anatomy. Some women we think are born with a shorter urethra, and as a result, it's easier for bacteria to get back up into the bladder. The vagina is full of bacteria, and the bacteria is healthy for the vagina. So we don't want you to be too clean. Don't wash that bacteria out. That bacteria is healthy for the vagina, but that is where the bacteria comes from. And sometimes that bacteria goes backwards into the bladder, whether it's during intercourse or whether it's from holding your urine for long periods of time, or it's from not drinking enough fluid. There are lots of reasons, but that's when it comes into behavior changes to try to prevent the urinary tract infections. There are lots of treatment options for preventing a urinary tract infection. The first is conservative measures. So you can increase your fluid intake, you can make sure that you empty your bladder on a regular basis. Don't hold your urine for long periods of time. Make sure that you're emptying your bladder at least every 3 to 4 hours throughout the day. Make sure that you get your bladder to empty. Some people have to double void or urinate twice. Urinate, wait a couple of minutes, and see if you can get those extra few little drops out to make sure that you're emptying your bladder completely. There are lots of conservative things that you can do. Sometimes we try other conservative measures, such as changing the pH of the vagina. If you're postmenopausal, we can add a little topical estrogen to your vagina to change the pH to try to prevent bacteria from going backwards up into the bladder. Other options, we can add cranberry pills to try to change the pH of the urine. We can add vitamin C, we can add probiotics. There is an over-the-counter product called D-mannose that coats the bladder to prevent bacteria from adhering to the bladder lining. There are lots of over-the-counter and conservative things that we can try. When those things fail, then we start to try medications. We can try a low-dose preventative antibiotic that you take after intercourse. We can try a daily low-dose preventative antibiotic, a low-dose antibiotic that you take every single day just to flush the system and try to get that bacteria out of your system. We have lots of options, lots of ways of preventing urinary tract infections.